Dear students, have you ever thought how clinical microbiologists differentiate bacteria that look similar on cultural media? The MRVP tests are one of the most important biochemical tests that help us to identify bacteria based on how they metabolize glucose. These tests are routinely used in clinical microbiology laboratories to distinguish the members of Enterobacteriaceae family and play a vital role in diagnosing infections such as urinary tract infection, neonatal sepsis, and GI infections. So let us start. What is the importance of MR test? First, identification of Enterobacteriaceae. It helps to distinguish closely related gram-negative bacilli. Examples are Escherichia coli, which are MR positive, Enterobacteriaceae coli, MR negative, Klebsiella pneumoniae, usually MR negative. It detects mixed acid fermentation pathway. MR positive organisms produce large amount of acids like lactic acid, acetic acid, formic acid and succinic acid. These acids lower the pH below 4.4, causing the methyl red indicator to turn red. Part of the IMBIC test. MR is one of the most important IMBIC series. For example, indole, methyl red, Proskauer test, citrate test. These tests are commonly used to identify coliform bacteria isolated from clinical specimens. Clinical relevance. In a patient with urinary tract infection, bloodstream infection or neonatal sepsis, culture may grow lactose fermenting gram-negative bacilli. The MR test helps to distinguish organisms such as Escherichia coli, MR positive, Klebsiella pneumoniae, MR negative. This assists in accurate laboratory identification and appropriate reporting. What is the principle behind the MR test? So this metabolic pathway mainly occurs in the bacteria. So first, glucose is converted to pyruvate. Pyruvate undergoes mixed acid fermentation pathway and forms strong acids. So these strong acids mainly decreases the pH of the medium, and the methyl red indicator is mainly converted to red complex at pH 4.4. So this methyl red indicator is the most important indicator in the MR test, which is at pH 6. It is yellow in color and turns to red at pH 4.4. Requirement. First, glucose phosphate broth or MRBP broth. Second, 24-hour incubating nutrient broth containing bacterial colony, that is mainly gram-negative bacilli. Third, inoculating loop, and fourth, methyl red indicator. Procedure of MR test. So first, take pure colony from the nutrient agar plate with the help of inoculating loop. Then this colony, then inoculate the colonies in the glucose phosphate broth. Then incubate at 35 degrees centigrade for 48 to 72 hours. And after incubation, add 5 drops of MR reagent and observe the reaction. Interpretation. Stable red color in the surface of the medium indicates MR test is positive. If the medium is yellow, then it represents negative. Precautions of MR test. Citrate and indole test should be performed along with the MRBP test because prolonged incubation may lead to destruction of acetone, resulting in false negative BP test results. Always interpret the MRBP test results after 48 hours of incubation, as this incubation period allows adequate production of stable metabolic end products for accurate interpretation. Do not over-incubate the MRBP broth, as prolonged incubation can alter the metabolic end products, leading to inaccurate results. Let us discuss the clinical scenario. A 24-year-old female presents to the outpatient department with complaints of burning micturition for 4 days, increased frequency of urination and lower abdominal discomfort, mild fever, no history of diabetes or recent hospitalization. On examination, suprapubic tenderness present, no flank pain. The clinician suspect a urinary tract infection. and sends a urine sample to the microbiology laboratory. Possible organisms are first Escherichia coli, Klebsiella pneumoniae, and Enterobacter cloacae. So what is the laboratory approach? So first gram stain showed gram-negative bacilli. Then the sample was inoculated in the clade agar, which mainly showed LF colony. Then inoculated on the blood agar and showed grey moist colony. Next, then the colony was subjected to the series of biochemical tests. So first indole test, positive, urease test, negative, then citrate test, negative. Next TIC showed A by A with gas. Then MR test, positive. BP test, negative. So the organism isolated is Escherichia coli. Next test is the Voges Proskauer test. Purpose: detects production of acetone, that is acetyl methyl carbinol, an intermediate product of the butylene glycol fermentation pathway. Glucose is converted to pyruvate through the Embden-Meyerhof pathway. Then pyruvate is converted to acetone through the butylene glycol pathway. So acetone mainly reacts with the potassium hydroxide and form diacetyl. Then diacetyl combines with the alpha naphthol to form a red color complex. What is the requirement? Glucose phosphate broth or MRVP broth. Then 24-hour incubating nutrient broth containing bacterial colony, mainly gram-negative bacilli, inoculating loop, and two reagents are most important in case of VP test. So first is the 40% of the potassium hydroxide and next is the alpha naphthol. So what is the procedure? First take pure colony from the nutrient agar plate with the help of inoculating loop. Then inoculate the colonies in the glucose phosphate broth. Then incubate at 37 degrees centigrade for 24 hours. Then after incubation add two reagents. So first add alpha naphthol, then potassium hydroxide. Shake well to provide oxygen for the reaction. Read results after recommended incubation period. Early reading may give false negative result. Keep the tube open to allow atmospheric oxygen to react with the acetone. So what is the interpretation? So look at the right side picture where a red color complex is formed at the surface of the medium, which gives positive BP test. What is the importance of MRVP test in clinical microbiology laboratory? The Methyl Red and BP test are biochemical tests used to differentiate members of the family Enterobacteriaceae based on their glucose fermentation pathway. How you will differentiate the enteric bacteria? Mainly based on the MR and BP test. So Escherichia coli, MR positive, BP negative. Klebsiella pneumoniae, MR negative, BP positive. Enterobacter cloacae, MR negative, BP positive, and Proteus vulgaris, MR positive and BP negative. Identification of uropathogens in UTI, lactose fermenting gram-negative bacilli may be isolated. MRVP helps to differentiate E. coli and Klebsiella and Enterobacter, which are MR negative and BP positive. So this assists in accurate diagnosis and treatment. Remember, in clinical microbiology, accurate identification begins with understanding the biochemical behavior of the microorganisms. Keep learning, keep correlating laboratory findings with clinical case and make microbiology easy and meaningful. Thank you for watching. If you want more microbiology concept made easy, please like, share and subscribe the channel. See you in the next video.